Thank you for coming, you guys. It's nice. I think I mentioned this is my first time doing a presentation like this, so I'm hoping for a little bit of beginner's luck. I knew I was going to be a little bit nervous, but I knew this also would be a very nice crowd, a very nice group, so it's a good place to have my very first presentation like this. So yes, as Nikki mentioned, I've been doing this for a long time. I've worked for Reinhold & O'Hara since 2012, but I worked for an agency in Medford for 5 years prior to that. So this upcoming Medicare season will be my 17th season educating people on Medicare mostly, people new to Medicare as well, helping them sort of navigate the different parts of Medicare, how you sign up, which plans are better suited for your lifestyle. It is very subjective. Certain plans are better suited for certain lifestyles and certain budgets, and then other plans are better suited for people that say that would not be in my budget or that does not suit my lifestyle. So my goal is to educate people and then help you to enroll. The enrollment part is actually that's where an agent like myself comes in, and that part is actually the easiest part. Once you have Medicare, the enrollment part is cake. That's why I gravitated towards it and said, "Oh wait, it only takes 10 minutes to get people enrolled. I think I can do that. That sounds right up my alley." This part is a little more comprehensive. This periodical you will get 3 months prior to turning 65. Somehow the whole world knows when you turn 65, and I believe people on Medicare already, you get one of these annually. Yeah, so once you're on Medicare's radar, you get a Medicare and you got a handbook. It has changed very little. Again, I started doing this in late 2007. It hasn't changed very much. There is a little bit of new material periodically, and because things like Medicare's deductibles change every year, they do update that information. But the fundamental here, what Medicare is, has not changed for a lot of years. I do recommend to people to at least peruse it. When you get your new one every year, check out your deductibles. I also recommend to people, depending upon the plan that you're on, every year the plan that you're on will send you information that says, this year you had this, next year you will have this. That's called an annual notice of change. Most people go, don't really care. The price is about the same. Doesn't look like they're taking away many of the benefits that I really value, and they pay very little attention. Again, I'm not allowed to give any specifics, but I would highly encourage for the people on Medicare, and I'm sorry, ma'am, I don't know if you already are on Medicare. Okay, so people on Medicare, this year is going to be a year that you want to pay particularly close attention to your annual notice of change. I've done a lot of webinars, a lot of meetings. CMS, that's the Center for Medicare Services, is projecting that this year will be one of the busiest years we've had in probably 20 years. And again, it's because, so it's a good question. The biggest thing is the Inflation Reduction Act has been passed and will go into law pertaining to Medicare. I believe it's already gone into law for a lot of the the environmental things, but the Medicare stuff, January 1st of 2025 will take effect. That's forcing a lot of plans to make some changes to their policies. And I have to kind of leave it at that. I know it's a little bit vague, but if you meet with me and you want to get information specific to it, I do have a slide that talks a little bit about it. But that's the biggest reason. So it will be a much more active year with companies leaving the Medicare market, prescription plans changing their coverages because of the changes that because of the changes the Inflation Reduction Act has written into law. So let's do a little bit of this, and again, I know it's going to be review for Lyle, for you, and for you, Rosemary. But good evening, you guys. But I want to start here. Again, I highly encourage you to look at this handbook. It's not perfect, but it certainly has very good material, and they cover pretty much every situation. So if you look at something and it says, if you're on COBRA and you're not on COBRA, skip over that part. If you have CHAMP VA and you don't have CHAMP VA, don't read that part. And there are a lot more scenarios. If you live in Puerto Rico and you don't live in Puerto Rico, skip that section unless you just really want to know how people in Puerto Rico get their Medicare. All right, so I'm done trying to be funny. Parts of Medicare. It's pretty straightforward. The card looks like this. I have a card that a client left with me and she replaced. This is your red, white, and blue Medicare card. This is your original Medicare card. We're going to talk about how you will get yours. Also you, if you're not on Medicare, I'll tell you how to enroll. But this is what comes in the mail. I can't tell you how many people say, and it's because your mailbox, when you turn 65, everybody on the planet knows that you're turning 65. They aren't sending birthday cards. They're sending information about Medicare. It's solicitations. So you will get stuff from every company. Your mailbox will fill up. But when you apply, and in some cases you don't even have to apply, your card will come automatically. Again, we'll discuss that. But this card gets chucked all the time. They're like, I might have thrown it away. It's not the end of the world. You can apply for a replacement card. But this is the one thing prior to turning 65 that you want to keep an eye out for. So that's the original Medicare card. You'll see that, and somebody asked already, what about Part B? Why isn't that on there? What about Part C? Original Medicare has 3 parts. Part A, basically it's hospital insurance. That's a little bit of an oversimplification in terms of an explanation, but mostly it's hospital insurance. Inpatient care in hospital, there also is a skilled nursing. We'll talk about that. There's a skilled nursing benefit. End of life, hospice care is covered under Part A. And then there are a few home health care benefits that are also covered under Part A. Most of the care you receive while you're on Medicare is going to fall under Part B, medical insurance. So that's doctor's office visits, outpatient procedures, home health care, durable medical equipment, preventive services, diagnostic services. All of that is going to fall under Part B. A and B make up main Medicare. The last part of original Medicare is Part D. This is the prescription element. D for drugs is the easiest way to remember that. But as you can see on the Medicare card, Part A and Part B come with original Medicare. You've got that package of goods. Part D does not come with original Medicare. You have to sign up for it. And depending upon what you decide to do, and we will move through the screens, depending upon what you decide to do with your Medicare eligibility, once you have A and B, depending upon what decision or what choices you make in terms of plans you enroll in, your plan might either include the prescription coverage with it, so you're all taken care of. Yes, I have Part D because I signed up for a plan that included it, or you may stick with original Medicare and need to then go sign up for prescription drug coverage. So there'll be 2 options. I promise we're going to get there. I'm ready to move forward a little bit, but so it's A, B, and D. Yes, there is a Part C. Somebody very, very wisely asked, but Part C is not part of original Medicare. It's a name that they've given to Medicare Advantage plans. So, and we will talk about that and how those plans work. I think I'm good here. All right. So actually, Missy, would you mind going out a little bit so I can get a little more of this screen? Can you guys still read the screen? Is it still legible? And I'm going to say certain things. So, okay. Your Medicare options. And again, this is a little bit out of sequence because I haven't told you how to apply for Medicare, and I know 2 of you will need to know how to do it, but that is part of the presentation and we will get to that. Once you have Medicare, you have basically 2 choices. Actually, you have 3 choices. If you decided that all you wanted was what you get from the government, Part A and Part B, that is perfectly within your right to have just A and B. If you do not sign up for Part D, a prescription plan, you need to know that down the road, if you at some point do decide to sign up for prescription drug coverage, you are going to pay a penalty. They call it an LEP, it's a late enrollment penalty. You didn't take drug coverage when we sent you your Medicare card. I can't tell you how many people come in 5, 6, 7, 8 years later. The longest one was like 15 years later. She said, I have to take some medications now, Ron, and I think I better get prescription coverage. Never has had it. Your late enrollment penalty is going to be significant, and there is a screen later that shows how we calculate it. I won't put you through the math, but just know the longer the period of time you go without drug coverage, if you do decide to jump into the prescription pool, you are going to pay the penalty gets bigger the longer you go without it. I have a lot of clients that have said, I take 2 generics, it costs me $7 a month, I don't want prescriptions, I will never sign up for prescription drug coverage. That's your prerogative. You do not have to sign up for it. As long as you know that if you did sign up for it later, that there's a penalty, you're perfectly within your right. Medicare says Part D is optional. It's optional, but we're going to penalize you. So that's a little wacky, but that's the wording. It says it 5 times in here, Part D is optional. So if you stick with original Medicare, I want the health insurance program from the federal government, Part A and Part B, you sign up for what they call a standalone Part D, standalone PDP, which is an acronym for prescription drug plan. That's how you would get Part D. There's also another plan that you might sign up for if you decide to stick with original Medicare, but that's how you would get prescription drug coverage if you stay with original Medicare. If you decide to do a Medicare Advantage plan, and we will talk about functionally how those work, or fundamentally how those work, it is also known as Part C. Medicare has kind of given that nickname. Medicare Advantage is a Medicare-approved plan from, typically it's a local company. Many of them are Oregon-based, but we do have some that are nationally marketed and sold. It comes from a private insurance company that offers an alternative to original Medicare. So what happens when you do that is you tell the federal government's program, Part A and Part B, I would like to put you on the sidelines for this year. I would prefer to go with a local Oregon-based, sometimes they're national, but a private insurance company that is going to offer me Part A and Part B, the hospital and the medical part. They're going to offer me that. They also are going to include prescription drug coverage, and in many cases, you get extra benefits. So, and we'll talk a little bit about what some of those extra benefits are. But fundamentally, those are your choices. And I think I said you have 3 choices, and one of them is, and I think I explained this, one of them is you can stick with just Part A and Part B from the government. The government does not say you need to go get a prescription drug plan. The government does not say you need to go and get a Medicare supplement. They're also called Medigap plans. We're going to talk about that. But they don't require that you do any of that. You can stick with just A and B. And they certainly don't tell you that you have to go and get a Medicare Advantage plan. Medicare Advantage is replacing your original Medicare coverage for that year. So you are deciding to put the government's program on the sideline and join this plan where you will get A and B coverage and also prescription coverage and some additional benefits. So is that pretty clear, you guys? It's 2 choices. When people come into my office, again, sometimes completely overwhelmed, sometimes I get part of this, but I'm a little confused. These are your choices. It's original Medicare or a Medicare Advantage plan. With original Medicare, we're going to talk about what you could put with that as well, because there are some gaps in this A and B coverage. They don't cover 100% of they don't cover 100% of a hospitalization, your outpatient things, your diagnostic, your office visits. Most of that is covered at 80%. So that's the reason that people decide, if I'm going to stick with original Medicare, I should supplement that coverage. And those policies are called Medicare supplements, or many companies market them as Medigap policies. Medigap fills the gaps in original Medicare, and Medigap and Medicare supplement are synonymous terms. They mean the same thing. Okay. I asked the question and I didn't really look for a response. Is that pretty clear? Do you guys get that? Thank you. Okay, so I dropped down a little bit. Here's what many people do when they decide to stick with original Medicare. And there is another section later in the handbook, and I will elaborate a little bit more. But basically, a Medigap does not replace coverage. It works alongside original Medicare. So you don't move this coverage at all. You keep A and B as your primary, and then you enroll in a plan with another. This again is a private insurance company, and all they are doing is they are waiting to get a bill from original Medicare. So Medicare, you go see your provider bills Medicare. Medicare then electronically sends the remainder of your bill. We've paid this amount, here's how much is left, and that private Medicare supplement company pays that amount to your provider. And generally speaking, and again, I'm oversimplifying a little bit, but by choosing the right Medigap plan, and we will cover a little bit of that, you're left with virtually no out-of-pocket. But that is a Medigap plan is a true Medicare supplement. It works alongside original Medicare by paying the remainder of the portion of the bill that Medicare didn't cover. Completely different from Medicare Advantage, right? We said Medicare Advantage means I'm choosing another way to get my Medicare benefits as opposed to directly from original Medicare. So they're
the same company?
So that's an interesting question. Do some companies market both types of plans? They sure do. In our Valley, Regents offers a Medigap plan, a Medicare supplement. They also offer a series of Medicare Advantage plans. So yeah, good question. It absolutely can be. It's things I've learned in the 17 years that I've done this. I'm struck by how many people come into my office. They didn't come to see me when they turned 65, because I say to people 4 or 5 times before they leave, you do understand these are two very different choices. Yep, I've got it, Ron, you've said it 4 times. But I'm struck by how many people on Medicare, 76 years old, I meet for the very first time, and they come in and they show me their ID card. It's a Medicare Advantage plan, and they say, this is my supplement. I say, sorry, I don't want to correct you, but this is not a supplement. Well, I have Medicare as my primary, and my bills go to Medicare, and then that's not what happens when you sign up for this. So that's really the fundamental. That's what you need to understand. Do I want to stick with original Medicare? And we're going to talk about some of the pros and cons, and I'm going to get us moving. In fact, here it is. So we're going to do a little side by side, and I'm going to say what happens with original Medicare, and then I'm going to say what happens when you sign up for a Medicare Advantage plan. And I'm going to qualify a little bit, because sometimes it's not exactly the way this Medicare and You book posts it. So I'll clarify. Original Medicare, you can use any doctor or hospital that takes Medicare. So how do you know? If you're in an ambulance and they take you to an emergency room somewhere, you don't need to find out if they take Medicare, because you're going to be fine for urgent or emergent care. Everyone will accept Medicare and bill them. If it's not, then you ask your providers, do you accept Medicare? This is my coverage. And whether you hold up your original Medicare card or you say, I'm on a Medicare Advantage plan, do you accept this coverage? That's how you know. Yes, we do. We accept Medicare assignment. Or, oh, you have the Regents Medicare Advantage plan? Yes, we do take that. It says here, in many cases, you can only use doctors and other providers who are in the plan's network and service area. That is generally true. Some plans offer non-emergency coverage out of network, but typically at a higher cost. That is true of most of our plans. What that means is most of the Medicare Advantage plans that are marketed here in the Rogue Valley are constructed or built as PPOs. That means we have a provider of networks, a network of providers, sorry. We want you to use our doctors. We work with the Asante physicians. We work with the Providence physicians. We have a good team of providers. If you electively decide that you don't want to see a provider in that network, are you covered? When you're on a PPO, you are. You just typically pay more. The out-of-network cost sharing is usually higher. So that is mostly accurate. Again, there are some Medicare Advantage plans that are very specific. They're structured as HMOs that say you see our providers or you pay the full cost of your care. And we will talk a little bit more about that. Original Medicare, do I need a referral to see a specialist? It says right here, you don't need a referral. On the Medicare Advantage plan, you may need one. Again, most of the PPOs in our valley, and when I say most, I don't think any of them still require a referral. They do not ask you to get a referral. So if you want to go straight to the dermatologist, that's fine. Your urologist, whoever it is, most of our plans now, can they ask you to do it? They can, but most of our plans do not ask to do it. They could. All right, let's bump forward a little bit. So this is going to tell us, remember I said, oops, okay, I'll stay here. So remember I said that most Part B covered services, you usually pay, the Medicare beneficiary, usually pay 20% of the Medicare approved amount after you've met your deductible. Part B of Medicare, original Medicare, does have a small deductible. I think everybody knows what a deductible is. I pay that first before my coverage jumps to 80%. That deductible this year is $240. So relatively little out of pocket before you're now covered at 80%. Medicare Advantage, out-of-pocket costs vary, and that's how I kind of have to leave it. But basically, most of our plans do not have a deductible that you have to meet, but they do have co-insurance. So you're going to have, they have co-insurance and co-pays, which means you aren't covered for 100% of most benefits. You're going to have a structured co-pay. I'm going to see a specialist, my co-pay is this amount. That's how it's structured, whereas with original Medicare, it's pretty much an 80-20 split.
Is there like a cap on out-of-pocket?
So it's a great question, and I think one of the slides, you're showing off a little bit, one of the slides says with original Medicare, I think it's on the next screen, does not have a cap. If you just had original Medicare, Part A and Part B, there is no cap on the 80-20. You could. You could. The Medicare Advantage plans do.
And that's you're not talking hospital yet.
That is correct. I'm on Part B, and I think that the slide gets to Part A as well.
Question.
Yes.
So when you say no cap, what does that mean exactly?
As simply as I can put it, if you have original Medicare and you don't have additional coverage on top of that, original Medicare you will continue to get bills for your 20% that you owe to potentially a very large number. There is no Medicare Advantage plans say if you hit this dollar threshold this year in your out-of-pocket costs, you will no longer pay. That's a max out-of-pocket. Once you hit it, then you're done with your co-insurance, your co-payments. So you pay a monthly premium for Part B, and I'm not going to go into all of the different options or variations of what you could pay. I will tell you, if your income is below a certain threshold, you may pay little or nothing for Part B. You might qualify for help to pay your Part B premium. If you make above a certain dollar threshold, and I do have a slide that shows what that is, it's $103,000 if you file a tax return as single. If you file it married, filing jointly, that amount doubles. to $206,000. If your income is above that threshold, you pay more than the standard Part B premium. The standard Part B premium this year, and I think there is a slide, but I'm going to hit you with it. It's $174.90. That's how much Part B of Medicare would cost you if you were Medicare eligible this year. That dollar amount does go up every year, and for people that are on Medicare, you know what it is. It's usually rather nominal. It's $5, $6, $7, $8, something like that. It's not a lot, but that is the standard Part B premium. When you're on a Medicare Advantage plan, you still have to continue to pay the Part B premium. Again, I've had people come in and say, I don't pay anything for my Medicare anymore. You do. Someone may be paying it, or they may just be pulling it right out of your Social Security and you don't know it. But if you're on a Part C, a Medicare Advantage plan, you still have to pay your Part B premium. Some of these Medicare Advantage plans have zero premium. That means you don't pay anything additional to your Part B premium. So people come to me and say, I don't pay anything for my Medicare coverage. Well, that's unlikely, but it is possible that you're not paying anything for your Medicare Advantage plan. We do have some in the Valley that have no monthly premium. And then some do have a premium, but it's relatively nominal.
You mean there's companies that are giving you a Medicare Advantage for free?
They are. I've never ever used that word, and Medicare says totally not compliant to do that. Free would insinuate that you don't pay for anything. There is you're still paying Part B, so you do still have that cost associated, but you don't pay anything on a monthly basis to the plan. You still have to pay your co-pays and co-insurance. So, but no.
The premium that normally you'd pay to the government, you're paying to this private company?
So that's essentially how it works. And Medicare is sending the premium that you do pay for Part B. They're sending that and a little bit more to this plan to now fund your care. That's essentially how it works. Yeah. All right. She said, don't push the up and down, and I do it every time. Sorry. So here's the. I think I may have covered that. Yeah. Some plans have zero premium. Okay. There's no yearly limit. That's a better way to say it. So, could you end up thousands of dollars out of pocket if you just had Part B or just Part A and Part B? You could. You can choose to buy a Medigap to help with your out-of-pocket, like the 20% co-insurance. So generally speaking, people on Medicare, if the monthly premium for a Medigap plan is something that's reasonable for them, they put an additional layer of coverage so that they're not on the hook for the 20%. I don't know why this says you can't buy Medigap, but so you know, you cannot have at the same time a Medicare Advantage plan and original Medicare with Medigap. For a broker like myself, it's totally illegal to do that. And I think somewhere here in the book it says it would be illegal if someone came and said, I have this Advantage plan, and I said, oh, you should also have a supplement. Those two do not go together at all. So anyway, so that gives you a little bit of information there. Let's move down a little bit more. I'm going to see if I can do. Okay, so let me go back one. Sorry about that. So I want to just do this. Original Medicare covers most medically necessary services and supplies in hospitals, doctors' offices, and other healthcare facilities. These Medicare Advantage plans, by law, when they get their contract with Original Medicare and take somebody away from Original Medicare and enroll them on their plan, they must cover all of the benefits that you would get with Original Medicare under Part A and Part B, right? Can't take somebody off and then say, you don't have coverage for physical therapy, or you don't have coverage for an MRI. So they cannot do that. They do offer extra benefits that Medicare doesn't cover. That's why when you talk to people that say, oh, I get dental from Medicare, they aren't getting it from Original Medicare. They're getting the dental from their Medicare Advantage plan that's offering some additional benefits as incentive to enroll in their plan. So dental, routine vision, hearing benefits, a Y membership, things like that are extra benefits that these Medicare Advantage plans do include in their coverage. So, okay. Part D, I think I've almost belabored that. Separate Medicare drug plan when you stick with original Medicare. You go and sign up for a standalone prescription drug plan. When I first started writing these, when the law first came, it was 2006. I started writing Medicare plans in 2007. I want to say it was close to 65 prescription drug plans, standalone. This year, I think we had 11 or 12 companies that offered it. And again, I'm giving you a little bit of a peek behind the curtain, but I'll deny it if you tattle on me. Next year, we probably will have less. So, but that's how you get prescription drug coverage, is from a standalone prescription plan if you stick with original Medicare. If you go with a Medicare Advantage plan, most of those plans have Part D, the prescription element of Medicare, built into them. So you sign up for the plan and you get A, B, hospital, medical, and Part D is included in that plan. There are some Medicare Advantage plans that do not have prescription coverage built into them. They are designed and intended for people that maybe get prescription coverage through the VA or possibly through another state-funded program. So they do design a Medicare Advantage plan with no drug coverage. If you wanted to sign up for it and understood that there could be a penalty for you, you don't have to prove that you're eligible, or you don't have to prove that you have VA. You can have a plan, you can have a Medicare Advantage plan with no prescription coverage. So foreign travel, I'll just hit on that really quickly. Original Medicare doesn't cover you when you're out of the country. They don't. Medigap has a little bit of international travel built into it. When I say a little bit, it's $50,000 lifetime. Most of the Medigap plans have built in. Medicare Advantage, they generally don't cover medical care outside the US, but they do offer, and most of our Medicare Advantage plans say if you need urgent or emergent care, that means unscheduled, urgent or emergent care outside of the country, we're going to cover that, pay for that. So, okay, so we're going to jump down a little bit. How's everybody doing? Good. Okay. Let me see if I bounce up. Getting started with Medicare. Okay. So I'm going to jump, because we haven't quite done this again. I think sequentially I'm a little bit off, but I've got a really smart group, so I know you guys are going to stay with me. This is basically for people that are on Medicare already. And you're not brand new to Medicare, but I'm on Medicare. January 1 is when your new coverage would take effect if you made a change during this. So my people that are already on Medicare, this window of time should be familiar to you. October 15th through December 7th. Technically that's called, the acronym is AEP, Annual Enrollment Period. Everybody that I meet calls it the Open Enrollment Period. So that's what I'm going to call it. Technically it's not though. This is the Annual Enrollment Period. Every year when you're on a Medicare Advantage plan primarily, you can evaluate and decide if you want to stay with your plan moving forward. You have an opportunity to change every year in this window. If you make a change in that 7-week window, which is the craziest time of year for me, not a sympathy grab, it's just really, really crazy. If you make a change there, January 1 is when your coverage would take effect. If you're in a Medicare Advantage plan and you miss this window, you still have the first 3 months of the year to join a Medicare Advantage plan. So, I didn't read my annual notice of change. I didn't realize my doctor wouldn't be in my network again. I didn't realize they took away alternative care. I didn't realize my prescription wouldn't be covered. Whatever the scenario is, if any time in the first 3 months of the year you decide I should have changed, you still can. And that change can be to another Medicare Advantage plan. I like these benefits a lot better. Or you can go back to original Medicare every year. Again, I meet people all the time that say, I left Medicare and I've been gone for 7, 8, 9, doesn't matter. Original Medicare will take you back every year. Now I'm going to throw one extra thing at you. It's not to be confusing, and it really is intended, it's better if we do it one-on-one, but I will tell you, under most circumstances, if you've been on a Medicare Advantage plan for several years and you came and saw me and said, Ron, I want back to original Medicare and I want to get a supplement, that Medicare supplement company is going to have some questions to ask you. And by questions, I mean they want to know a little bit about your health. It's called medical underwriting, and they want to know a little bit about you. If you say, I'm 80, I'm incredibly fit, I don't drink, I don't smoke, I go to the Y every day, the plan will say, thank you, we'd love to have you insured with us. If you say something contrary to that, like, I have some pretty serious health things going on, then original Medicare will absolutely take you back. There is no issue with your overall health whatsoever. It's the Medicare supplement piece that's going to pay that 20% that will send you a polite letter saying, no thank you. So,
How about when you're first signing up, like me?
it's great question. I was going to hit that on another slide, but again,
All right.
it's all good. I'm going to answer it. The short answer is you have a protected period of time, and it's basically a full year. So you have a protected period of time where there is absolutely no medical underwriting. Again, I think a lot of people miss this. When the Affordable Care Act, this is probably a little more information than you need, but when the Affordable Care Act was written and they did away with medical underwriting for the under 65 crowd, my Medicare clients come in all the time and say, there's no underwriting in insurance. There is still medical underwriting when it comes to the Medigap plans, the Medicare supplements. So, but those are essentially the windows where you're making changes. Again, not when you're new, there's going to be a slide, but that's when people that are already on Medicare, if you wanted to come and review your coverage, here's your first opportunity during the year. Now there are other situations as well, and people always say things like, what would happen if I move though? If you move or you lose coverage or you have opportunities to change. You're not stuck until October 15th. It's just if you're...
If you go from original to an Advantage plan, past that 1 year window?
Also a good question. Medicare Advantage plans have no medical underwriting associated with them at all. And regardless of your age, you pay the same premium. It's called community rated. Doesn't matter if you're 65 and new to Medicare or 95 and in horrible health, you pay the same premium as everybody else on that plan. And there is no medical underwriting whatsoever. Their only criteria for joining their plan is, are you both A and B eligible? If you've got A and B, you can have a Medicare Advantage plan in any shape that you come. So, okay, let's jump forward a little bit. So again, this is a little out of sequence, but I'm following the Medicare handbook, signing up for Medicare, and I'm going to be a little bit short. I hope that's okay with you, Stephanie, because I think you may be there, well, actually maybe two of you. So generally speaking, the overall rule is if you're getting any Social Security benefits, so maybe you started drawing at 62, or maybe you get some benefit for being on Social Security through a disability. If you are on Social Security's radar, you don't have to do anything when you turn 65. The card is going to show up in the mail 3 months before the first of the month in which you turn 65. You said yours is February. In November, you're going to have a card in the mail. Boom, here it is. If you're not on Social Security's radar, and this happens a lot more than the opposite, if you're not, so this says again, if you're under 65 and have a disability, you will get, after receiving Social Security benefits for 24 months, you will automatically you'll be entitled to Part A and Part B. So also if you have amyotrophic lateral sclerosis, you also would be eligible for Medicare immediately. Pretty much everybody else has to, if you automatically get it, you'll get your red, white, and blue card 3 months before your 65th birthday. If you don't, get it, you have to sign up for Medicare. And again, this window comes and closes for a lot of people. I'll tell you what the consequences are. They're not irreversible, but if you miss the window, then you have to sign up at a later point. Don't miss the window. The easiest way to do it is you can go to ssa.gov. You make sure in the top right corner of the window it says, this is the official site for the Social Security. There are people that have figured out a way to come on your screen when you put ssa.gov in. So just make sure you're in the right area. You can also go to medicare.gov, and there is a link to Social Security to sign up for it. It's the easiest way to do it. It'll take you, if you have a Social Security login created already, signing up for Medicare takes about 10 minutes. Really, really fast. So this tells you here again, if you don't sign up for Part B when you're first eligible, there are scenarios where you will not be penalized, but if you don't have other coverage through an employer or a spouse's employer, and you just blow off Part B because you don't want to pay the premium, I'm healthy, or I don't understand all this stuff I'm getting in the mail, I'm not sure what to do, and you miss your window, you are going to pay a late enrollment penalty for as long as you have Part B. It's the way it's set up now. Generally speaking, people don't, they don't sail 4 or 5 years past it, but you might miss it by 6 or 7 months. I was just overwhelmed with stuff. I didn't know what to do. It looked like it happens quite often. You'll have another opportunity. They have what's called a general enrollment period where you can enroll every year. And again, I know this doesn't apply to a lot of you, but anyway, and I can be very specific about how to enroll if you need some help. So,
are you penalized for life? Like your premium will always be higher?
It's a great question, and the answer is yes. They add it on to your Part B premium, and you pay that late enrollment penalty permanently. Just like you pay the Part D late enrollment penalty for the entirety of the time you're on Medicare. I suspect that there's going to be some legislation. I don't have a crystal ball, but I think that may change. End-stage renal disease, that is another, and I'll breeze past that, but that's another reason that you can get Medicare, and it's not related to your age. Okay. Again, generally speaking, the Part A that covers your hospitalizations, your skilled nursing facility, and end-of-life hospice care comes to you premium free. You don't pay anything for that. You've paid, again, generally speaking, through your working career. When you pay Medicare taxes, this is the part of Medicare you're paying for. You're paying a little bit for B as well, but your work history gets you Medicare Part A with no premium at all. So if you don't have the work history, either you or your spouse, because if you never worked but were married to someone, and I think that time frame is 10 years, you can be eligible based on their work history. If you never worked, never paid Medicare taxes, when you go to sign up for Medicare, you'll have a premium for Part A as well. And that premium is quite a bit more than does anybody remember what the Part B premium was? That's all right.
174.
174. Thank you. You guys are a sharp group. I know that's not fair of me to throw. I promised you wouldn't be tested or quizzed on any of this stuff. Okay. We talked about your initial generally 3 months. So actually, your full initial enrollment, which is what you'll be in, is 7 months. It's 3 months prior to your birthday month, the month of February, and then 3 months past. So you have a 7-month window to sign up. That, interestingly enough, also coincides with what the Advantage plans say. If you want to sign up for us, do it in this 7-month window. Quick example, turn 65 June 2nd, 3 months prior, March, and ends in September. If your birthday happens to be on the 1st of the month, it starts a month earlier. So for people that are born on the 1st of the month, so if you were born on June 1, your Medicare would actually start May 1. So, okay. special enrollment period, and you'll see that acronym a lot, and I'm not going to spend a lot of time on that. If you have one, you'll know it. It's usually for people that say, I'm turning 65, I work for a company that gives me health insurance. Do I have to sign up for Medicare? And the answer is no. It's your prerogative if you say, I want to keep the coverage I get through my employer. So I'm going to wait to apply for Part B. A lot of times it makes sense to take A. You're not paying for it. It's extra coverage for hospitalization. Now you're on Medicare's map. You've got Part A. Your employer will be grateful you did it. There might be some, there might be some coordination of benefits that you have coming, but you don't have to. If you decided just to wait until you were ready to retire, but it does, and they say it twice in the booklet, and I have also had people that unfortunately had a challenge. It has to be based on your current employment or your spouse's current employment. You can't be on a retiree plan. I retired from this company 10 years ago. I'm on their retiree plan and waive off on Part A and Part B of Medicare when you turn 65. That does not work and results in a late enrollment penalty. So based on your employment, you have coverage, or a spouse's. Okay. I'm not going to spend a lot of time talking about COBRA, but it's another situation. COBRA and the marketplace. I don't know if anybody has worked with healthcare.gov and had coverage through the marketplace. I've had people somehow, the marketplace's plan, MODA, Regents, whoever it was, didn't bump the person off, and the person stayed on past the month in which they turned 65. It gets a little bit messy. You end up owing, if you're getting a subsidy, you end up owing some of that back. So you just want to make sure if it's COBRA, you want to come off of COBRA and start your Part A and Part B. That's not considered, that's a continuation of health insurance through your employer, and they want you to come off that. Again, there is a general enrollment period. That's where I said people miss their initial enrollment period. You've got a safety net a little bit. Again, you're going to be late, but every year it falls from January 1 to March 31. So you have that same first 3 months of the year to now sign up for Medicare if you somehow missed it. And here's I have other coverage. Do I have to get, if you're still working or your spouse is, you can waive off on that. There are other situations as well. I'm not going to do that. These are pretty specific. I will touch on Medicaid.
Can you just refresh what?
Yeah,
the
sure.
Health insurance marketplace. It is a seamless thing to cancel one and start the Medicare and.
Absolutely, and I think I have it somewhere. I don't remember where it is, but it is. And it's pretty easy to notify. If you've worked with an agent for healthcare.gov, tell them. I'm turning 65 in February. January is going to be my last month. Because if you leave it up to them to do it, it may not get done. But it is seamless. You stop that coverage January, and February 1, your Medicare starts. Here's the marketplace. You should generally sign up for Medicare when you're first eligible to avoid the risk. And they give some information here about some people that have marketplace coverage are getting help paying their monthly premium. If you're getting help paying your monthly premium and you go past the month in which you're Medicare eligible, you're going to have to get that back to the company. I'm not going to spend a lot of time on HSAs because I don't think my audience wants me to, but basically an HSA is a savings account that you put money into for your medically necessary care. You must stop doing that when you're Medicare eligible. You cannot continue to contribute to an HSA after you've started Part B of Medicare, and they tell you when to stop. Anyway, that's another one. This is a little bit, no, this is pretty specific too. Just know that if you do decide to stick with an employer plan, when you turn 65, I would definitely check with your employer to say, what happens? Are we primary and then Medicare would be secondary, or is Medicare primary? Each scenario has a different. Fewer than 20 employees, Medicare is going to be primary, and that small employer is probably going to say, sign up for Medicare. I want them to be on the hook for most of your health costs, and I'll pay the backside. There are different scenarios based on the size of the group, so talk to your employer and say, what do you want me to do? What's best for us? What's best for me? And again, if the most, I'd say the most egregious, it's not egregious, the longest I've had somebody come, 91 years old, this gentleman came, he'd worked at the Oregon Shakespeare Festival and said, I've never been on Medicare. I've always had coverage through the Shakespeare Festival. 91 years old, we got him signed up for Medicare, so all that to say, you can do it, and you can do it for as long as you want. So, and then there's some coordination for people that are VA eligible or TRICARE for life eligible. There's that would be, again, something specific you would talk to me about. Do I have to pay for Part A? I believe we've covered this pretty well. There is a premium for people that don't have the work history. Is there a late enrollment penalty for Part A? There sure is. If you have to pay for it and you blow right through the window of your Medicare eligibility without other coverage, there is going to be a penalty. So, okay. There's the number. Oh, I said 174.90. I'm not very good at my job. It's $174.70. Remember, I hit you with a couple of numbers that say if your income is above this amount, you're going to see this. It's IRMA is the acronym, an income-related monthly adjustment amount. Medicare says and Social Security work together and say this person makes a lot of money, you're going to pay a little bit more for your Part B. So here's the Part B late enrollment. Again, I don't want to get too specific with it because if you're at this presentation, you're not going to blow through the window. But it's 10% for every year that you don't sign up for Medicare. And again, that is a permanent penalty that you pay as long as you're on Part B. Okay. So I just thought I'd look at, wow. Has it really been 55 minutes? You guys doing okay? Does anybody need to stand up? Or I didn't think I could talk for 30. Remember, Nikki? I was like, I don't think I can talk for 30 minutes. And look at what I'm doing. So they do break down in the Medicare and You booklet, and if you want specifics on it, but they break down everything that's covered under Part A and Part B. And when I say everything, there's 16,000 codes for medical things, but they do give you categories. We'll go through this here. I don't think I did the whole thing. So basically, here's what Part A covers. We talked about the hospitalization, which is going to be on the next screen. There's a little bit of coverage for blood, a little bit of coverage for home health, and then end of life. When you're on hospice, Part A of Medicare takes over, kicks in. That's true if you're on an Advantage plan as well. So if you're on a Medicare Advantage, the Medicare Advantage plan comes off the hook and you go back to original Medicare for your hospice care. And there's, yeah, go ahead.
I'm sorry, Matthew.
That's all right.
I was going to say, what about, I forgot we were talking about, I'm sorry, I lost my train of thought.
That's okay.
Hospice, burial services.
So it's a really good question. There's really nothing from Medicare at all. There is no coverage for that. Those types of policies are from private insurance companies. You plan through a final expense policy or something like that. Medicare has no.
I have a question for hospice too. Like, it seems like having helped someone go through hospice, it seemed like there was no co-pays or anything. Everything was just covered.
It's a great question, and I think one of these slides does show. And basically, you pay nothing. You pay nothing for hospice care. There's a co-payment of $5 for some prescription stuff, and then a small 5% for some inpatient respite care. But you're right, it becomes virtually no cost.
Is the hospice in a facility or in your home?
Generally speaking, this is not in a facility, but this is saying that you have a small co-payment if you're in inpatient respite care. Generally speaking, this is someone's comfortably at home or possibly in a facility. If you're in a living in a facility, hospice will still kick in and pay. The care must be in a Medicare-approved facility, like a hospice facility, hospital, or skilled nursing facility that contracts with hospice to do that. So, I'm going to kind of quickly go through this too. This is inpatient hospital care. I mentioned that Part B of Medicare has a deductible. So does Part A, the hospital part, and the hospital part's deductible. Part B has a deductible, I mentioned, $240. That's a calendar year deductible. You meet it once, you're done for the entire year. If you go on Medicare in February, January 1 of the following year, your $240 deductible is going to kick back in. Your hospital deductible is per benefit period. And what that means is that each time you're hospitalized, you're going to pay this deductible. And it's quite a bit more than $240. This year, 2024, it's $1,632, 1,632. Last year it was exactly $1,600. It went up $32. That's what you're going to pay per hospitalization. Most of the rest of your care, there are a few little ancillary charges sometimes, but most of the rest of your care is covered. Days 1 through 60, each benefit period, you pay $0 after you've met the deductible. Are there circumstances where you could go 60 to 90 days? There are, but I'm not going to hit you with those. It's pretty rare that someone's hospitalized for that period of time, but it becomes a pretty big co-insurance premium. Yes. But this is pretty rare. Yeah. And if you have an Advantage plan, once you've met your co-insurance for the first 4 or 5 days, you're done. And if you have original Medicare, hopefully you have a supplement, and the supplement covers your deductible and your co-insurance. Okay, so it's pretty rare that people end up here. So, yes.
I had a request to make the slide bigger, but I don't want to mess with it.
Oh, okay.
Is it okay to zoom in?
Sure.
The text?
Sure, yeah.
Okay.
Oh,
Is that,
yeah, no, that works just fine.
Everybody can read it.
Okay.
I have a question.
Sure.
I think you may have already covered it because I arrived late, but
It's all right.
and it may be a stupid.
There's no late enrollment penalty, or no late arrival penalty. Again, me trying to be funny.
Yeah. Ambulances and that kind of thing. They're
Yeah,
not,
no.
Are they covered by Medicare?
Oh, sure. That's Part B. That's not Part A. That's
Okay.
Part B.
All right.
So yes, and generally the way that's covered, Advantage plan is totally different. They have a flat dollar copay for an ambulance ride. Under original Medicare Part B will pay 80%. Hopefully you have some type of supplemental coverage. They'll pay 20. You pay nothing for, and that includes air ambulance as well. So whatever type of
I have another question, but it also feels like it's kind of stupid.
that's
Like, I don't understand the deductible and the, like, after you put out $200 deductible per year.
yeah.
And I know this is back to Part B, but and how does that combine with your co-pays or whatever, the 25%, not 25%, the 20%.
So I think the simplest way I can say it is the deductible is I pay this first. It's kind of like an auto, my car insurance, my deductible, my windshield broke, and I have a deductible of $250. You pay that to the shop. Okay. With this, it's a little bit different because you don't pay it to. So if the first use of your Part B of Medicare is you went to see a doctor and the doctor sent the bill to Medicare, what Medicare does is this person hasn't paid their $240 Part B deductible. So if the bill is $200, how much of the bill is Medicare going to pay? Nothing. They're sending it.
Okay, so
They're.
it comes right off the very first thing that you
That's exactly
do.
right. Sorry if
And
that
then-
was your
and-
question.
and
Yes.
after that, you
And-
owe
and then-
20%
That's
of
right.
everything.
And then after that, it's straight to 20%. Again, if you have a supplement, Medicare gets the bill. Yep, deductible's been satisfied. They pay their 80. They electronically send the bill to the supplemental company. They pay their 20, and you get something in the mail that says, this is not a bill.
Okay,
Yeah.
yeah, thank you.
Sure.
So if you get a bill for $200, it's not going to cover it. You should ask the doctor to please add $50 onto the bill.
It's very creative. Nice job. That was not part of the presentation for the record, but yeah. All right, so I'm not going to spend too much time on this. Let's see if this gets a little tricky. I just want it to be on your radar. You do want to ask providers. It's not up to you to decide whether, if you're kept overnight for observation, is that Part A of Medicare? That there are some situations where you need to clarify with the provider, hey, I just want to make sure that this is going to be billed to. Generally speaking, if you're on an Advantage plan, it's not a problem, but sometimes with original Medicare, I've had people have a bill kicked to them that was covered under Part B instead of Part A when they were observed for a night. Just have it on your radar and be aware that could be an issue. I'm not going to spend a lot of time talking about skilled nursing coverage, except to say, and I think this is important, and I have a slide that says what Medicare doesn't cover. When you read and hear and see skilled nursing, I think a lot of people put in their brain, I now could live in a skilled nursing facility. That is not what the benefit is for. It is not long-term care. There has to be a qualifying event. Usually it's a stay in the hospital. And the typical scenario is the person's well enough to leave the hospital. They don't need to stay there, but they're maybe not well enough to go home. Sometimes it's joint replacement. Sometimes it's other care. If you are going to rehabilitate in a skilled nursing facility, there is a short period of time that original Medicare will cover that. And here's what original Medicare says. Days 1 through 20, you pay nothing. Again, there's criteria. You have to be rehabilitating. You have to be there for a temporary stay. You don't have to figure that out. The skilled nursing facility will.
You have to be making progress.
One of the criteria. That's absolutely true. And if you're in a Medicare Advantage plan, again, I have to be careful about how specific I am, but generally speaking, that's the case as well. After day 20, this is what original Medicare does. Again, if you have a supplement, they'll cover that $204 per day copay. With Medicare Advantage, you may have some of the costs coming to you. So, again, let's see. And this just basically does the Part B. What do I pay for that? And there's a pretty significant part in the booklet. It's about 20 pages of everything that Part B covers. And again, it's categories, so it's not telling you benefit by benefit, but it's saying these are the categories we cover. And I thought that would be painful for me to go through and painful for you to listen. So I'm sparing you that. Let's see if. Okay, I think we've done the 80%, 20%. Kind of an interesting thing. This didn't used to be, but I think this was part of the Affordable Care Act as well. You have a welcome to Medicare benefit. So when you ladies are new to Medicare, you get to do a preventive visit.
Does it matter when we've had a previous preventative med?
It doesn't. It doesn't. Once you're on Medicare's clock, it's brand new and you get to start, and it's pretty comprehensive. You wanna make sure your provider knows, hey, I'm new to Medicare. Here's my new insurance, or here's my Advantage plan. This is my new insurance. Make sure it's clear. Make sure they have that set up, and it's pretty comprehensive. If they have to do a procedure in that preventive meeting, just know that it turns from no cost sharing at all to there potentially could be some cost sharing associated with it.
Preventative visit, it's 100% covered?
It is.
But the stuff that they might do, like blood and lab work, that's not.
That part would all be covered. If it's a procedure and they have to do something that would qualify as an inpatient procedure, then it could turn into some cost sharing for you. But the lab portion of it, the blood portion of it, is 100% covered. After year one, Medicare does not pay, and most providers, this is getting a little specific, but most providers know how to bill your annual visit so that it is covered, but Medicare does not pay for an annual routine physical. They do not. A Medicare Advantage plan will. Original Medicare does not, but they do pay for, they do a yearly wellness. And basically that, it's not a physical exam. It's more, my understanding, I'm not on Medicare yet, but my understanding is it's more dialogue, it's more lifestyle. They're doing a health risk assessment. Are you at risk for this? Are you? And they do it, they can do it annually.
It doesn't include lab work.
Does not. Does not.
It's one of the best ways to think.
I totally agree. The doctor is doing evaluations, potential risk factors, things like that. Okay.
So also an annual physical isn't included if you have regular Medicare plus a supplemental. It's not included.
That's correct. Again, I'm suggesting that most providers know how to get that done and still bill it.
Okay.
And again, that's not me saying, hey, let's cheat the system.
Right.
I'm just suggesting they know how to do it. They don't bill it as, this was a routine.
Right.
Lyle came in, he's super healthy. He just came in because he wanted to say, look how healthy I am. Okay, that's not going to
So
be covered.
those
But
other things that are covered under the Affordable Care Act, like the colonoscopy, women's health stuff, and is all, it just kind of ends with Medicare?
No. Those are all covered. There are several things that are considered preventive that are covered at 100% by Medicare. And if you join a Medicare Advantage plan, most of those plans pay for them at 100% as well. So anything that, I shouldn't say anything that, but things like mammograms, colonoscopies, all of those things are. Bone mass measurements. There's a list in the booklet of like 18 procedures that are covered at 100% as preventive. And if you have certain...
With just B, or do you have to have the supplement or Advantage?
With just B.
Okay.
Just under original Medicare.
Because you
and
just
if you
said a
have
slide or two ago that the annual exam is not, and that's something that Affordable Care Act does usually pay at a pretty high rate.
But it was specific to a routine physical, so you weren't asking about, if you were asking about like...
But a routine physical under 65, under Affordable Care Act policies, it's covered,
It is.
just like
So that,
mammograms,
that benefit does go away at 65.
just the physical exam.
That's correct.
But all those other new ones are still on.
Are
in
still on.
Medicare.
Yeah.
That's
And there's a section of the...
That is so dumb. I mean, like, what's more important than just an annual checkup?
For the number of people that say, that's really dumb, if I had $1 for everyone that said, there are a lot of things that Medicare doesn't do. There are things that they get
Yeah.
right, but there are things that they don't. I feel like they should cover alternative care. I feel like they should cover dental. I feel like they should allow you to have an eye exam. But I'm
Yeah.
going to spend a little bit of time on this again. I don't want to spend a lot, but some items and services that original Medicare doesn't cover include, and this is not in order of importance, because I'm going to hit you with this one a little bit, but eye exams. So if you're going for a routine eye exam, because I need to change my glasses, it's not covered. Long-term care, this is a big one. And people are surprised by it all the time, and hopefully the surprise doesn't come when you need the care, and that you get it early and you at least have times to explore that, but you get no help at all from Medicare once you're eligible. And I say eligible, once long-term care kicks in, and that's very specific. You know, there are certain criteria that you meet, but this benefit has to be covered by a private insurance plan, or you're self-insuring for that. You're going to pay for your care, or you're going to allow the state to care for you. So that really is the biggest one. And through the years, I'm very surprised when I say to people, this is important, long-term care isn't covered. People are very much caught off guard by that. So it's a good idea to plan. I mean, if you're 80 years old, it's the window to plan has closed. Okay, some pretty obvious ones. Cosmetic surgery, darn it. I was hoping once I got there I could have a few things done. Not covered. Massage therapy, there's your routine physicals. Hearing aids and hearing exams, it's not covered by original Medicare. Medicare Advantage plans, again, without getting too specific, most of them do offer some type of additional coverage for that. They talk a little bit about opt-out doctor. If you see a provider that says, I do not work with Medicare, I won't bill them, I won't take the little amount that they're going to pay me, and they basically are saying, I do not accept Medicare assignment, you're going to pay whatever that is, whatever the cost of that visit is. So negotiate that. Most dental care, no routine cleanings, no fillings, extractions, dentures, bridges, root canals, all that stuff. You're on your own for that. Can you get a plan that will help with that? Sure, but don't ask just bill Medicare, because they're gonna look at you like, can't do that. Okay, and there is a portion in the book that talks about paying for long-term care and how you get it, and again, that's something that everyone should visit, but just so you know, that's.
I have a question, like,
Sure.
you can either ask the provider, but if you have, like, if you're on MODA, you can call MODA and you can say, is this person, do you have a contract with them? Is that how it is with Medicare, or do you have to ask the provider? Does Medicare keep a list, like, in your state or your city?
That's an interesting question. I would say that Medicare does not have a list of those. Your Advantage plan will say, this is our provider directory. Here's all of the physicians that we're appointed with. It will be 1,100 pages,
Yeah.
but yes, they will have a booklet.
And how about the supplement, the gap ones?
The Medigap plans are simply bill payers. They're not going to
Okay.
tell you who you need to go see.
Okay.
So I think the most common way, and not to sound like a smart, ask the provider.
Yeah.
I'm on Medicare now. So before you go in to see them, I'm on Medicare. Do you accept Medicare? We're still pretty lucky in the Rogue Valley. Most of our providers still do. Are there parts of the country where that is not always the case? There are. Are we having some providers that say, I'm not going to take the Medicare reimbursement, so you ask about that. But it's a good.
There's a concierge doctor that goes, you gotta have $9,000 to walk through the door.
That seems insane to me, but I do know that some providers are going to that. You pay a concierge fee, your Medigap plan will not pay that, Medicare will not pay that, Medicare Advantage plans will not pay that. There will be no reimbursement for that. So,
What is a concierge doctor? I want to understand what that really is.
So essentially, it's a fee. It's a fee that providers charge to allow you to come and see them. In other words, if you want to book an appointment with me, if you want to be on, a schedule where I see you once, twice annually, you're going to pay an underlying fee. The reimbursement rates from Medicare have become an issue for some providers, so they're not willing to just do that, but they are able to charge that. I don't quite understand.
So it's like a cover charge at a club. Like, you just can't walk in, you gotta pay money.
Subscription.
Okay, or a subscription,
Yeah.
or a subscription. I pay a monthly membership, to be able to come here.
I'm
So-
finding things are slowing down in the valley with medicine, that it's getting difficult. I've been going through something for a very, very long time
Yeah.
with Asante. There's some cog in that situation where it's going extremely slow. They're very tight-lipped. They won't talk about it.
I'm hearing similar feedback. Yeah, it's
Yeah.
interesting.
So
I think
it's-
that's the case, and
It's starting to fall apart by one person's omission, so
yeah.
just saying.
you really do have to kind of be your own. You have to drive it. You have to look and find. I've had people say, you know, and I personally experienced it when I needed a little physical therapy in April, and they said the first appointment available was in August, and I'm not on Medicare yet. So are we experiencing some shortages? Are are people getting left? I think you can all conclude that, yeah, that's becoming an issue. This is, again, a little bit more about original Medicare. We know it doesn't cover prescriptions. Do I need to choose a primary care doctor? No. Do I have to get a referral? In most cases, no. So Medicare is telling us again in their booklet, we make it a little bit easier for you, I think is their intent here. So, and again, to reiterate, and it was a great question, if you choose original Medicare and a Medigap plan, the Medigap plan has nothing to do with your care. They will never ask for authorization. They are simply an insurance company that's waiting to get a bill from Medicare, and they pay it. Don't
If
ask.
your doctor refers you to a specialist, you better say, wait a minute, is that specialist take Medicare?
Well, yeah. So it's smart to do that. Generally speaking,
As opposed to calling up the urologist or the PT or whatever.
Generally speaking, I think if a provider refers you and knows the coverage you have, and again, it might not.
That's a pretty big assumption.
Does it? Okay. Does it make sense to make sure? Yeah, it probably does.
Doctors, I would ask. Because it costs money.
Okay. Should I get a supplemental policy? Kind of depends. If all you have is original Medicare A and B, you should. This is if you're sticking with original Medicare. But Medicare won't come out and tell you, yeah, you should. But they do say if you don't have something else like Medicaid or union coverage or employer retiree coverage or employer or retiree coverage, you might want to buy one. Again, they don't require it, so we've talked about the deductible. We've talked about how you'll have a little co-insurance or co-payment. We talked about the fact there is no yearly limit with original Medicare. That goes out the window if you have Medigap. There becomes a non-issue. You pay a premium for Part B. There's a few things in here that I was gonna talk a little bit about, but I have been a little bit long-winded. This, they do tell you how, when you see a provider and you want to know what was billed, what do I owe, that Medicare does their own Medicare summary notice. I think a lot of people call them, refer to them as EOBs, explanation of benefits. It says, here's what we, the plan, paid, here's what you may owe. Medicare has their own summary notice that they send out, and I think now that they do that, I think they do it it's either every other month or quarterly. So you'll get a summary of the providers you've seen, what the provider billed, what Medicare allowed, and then if you have a supplemental piece, Medicare doesn't have that on theirs, but the supplemental piece also sends you something quarterly, saying we got 7 bills from Medicare, and Medicare paid this, we paid this, and you owed 0. Or you owed something if you did, but most of the plans you don't owe anything on. Okay, and they tell you how to get them electronically. Hey, you can go to medicare.gov. That's something else. I'm not a schlep for Medicare, but they do have a system where you can enroll yourself. You put your Medicare information in, and you can keep up on, you can look at office visits, you can put in your prescription coverage, and it saves it for you. So I think it's worth the little bit of time. The Medicare website is constantly being tinkered with to improve it and make it more user-friendly. It drives this agent crazy, but I think overall it's pretty helpful and very user-friendly. So I think we talked a little bit about this. I said, do they accept Medicare? That's the word. Assignment means that your doctor, provider, or supplier agrees or is required by law to accept the Medicare approved amount. Why is that important to you? You don't want your provider saying, I billed them $1,800 for this MRI, they paid me $600, you owe me $1,200. not if they accept Medicare assignment as full payment. You will not have out of pocket, provided you have the supplemental piece. If you don't, then you're going to owe 20% of whatever the Medicare approved amount is. So I hope that makes sense. I'm going to hit just a little bit on Advantage plans again. And I want to kind of speed this up because I want to hit these two other screens. Advantage plans, we've talked about them. Do they make sense? For some people, they do. For some people that come in and say, Medicare is going to be $175, the Medigap plan is going to be this amount, and there are people that say, that is not doable for me. I cannot work that into my budget. So Medicare Advantage plans have a place for some people when affordability is an issue, and also for people that say, I value the extra benefits I'm getting from this Advantage plan. I value the extra care that I'm getting for certain things.
Are you implying that the Advantage plans can be cheaper?
I am implying that.
Huh.
I think there was a slide back there that said that they sometimes have no monthly premium.
Right.
Yeah. So yes, they can be. So so there is a play. Again, everyone, it's very subjective. Some people decide to do that. Medicare Advantage plans come in a couple shapes. We do not have private fee-for-service. We do have special needs plan that's very specific to someone's overall health. Most of our plans in the area, Medicare Advantage plans, are this. They're PPOs. I think I talked a little bit about that. We also do have a couple of plans that offer an HMO. An HMO is going to be more restrictive than the PPO because it's UCR network providers or you're not covered. Okay, so and again, we don't have medical savings accounts. We don't have private fee-for-service in our valley, so you're not going to see those. It could change. Stay up on your things. Okay, I think I'm gonna jump out of this towards the end of the Medicare and You booklet. Important. So when you're on a Medicare Advantage plan, we did talk a little bit about this, you're going to get an annual notice of change. It is important to review those, particularly this year. Your plan is going to start sending a copy out September 30th. Remember we talked about that window, October 15th through December 7th every year. That's your opportunity to evaluate and change. You're going to know what your plan is going to look like the following year because the annual notice of change will have been sent to you. So they also send out an evidence of coverage, which is a lot more detailed. The annual notice of change is just for changes that they're making. The evidence of coverage basically includes everything that they're going to cover the following year. So you got to have Part A and Part B. You got to live in the planned service area. If you live here in Jackson County, many of our plans are specific to Jackson and Josephine County. Got to live here to sign up for them. So here.
They'll cover you if you go out of that area.
Thank you. Urgent or emergent care is covered pretty much worldwide. In another state, no problem. They'll cover you if they're a PPO and you say electively, I want to go see a doctor in San Francisco. Yes, you're covered. You're just going to pay a higher cost sharing. Yes.
What happens if you moved out of state?
It's a great question. If you move out of state, you now have a new Medicare says you can completely start over. You can come back to us, original Medicare, and get a Medicare supplement with no health questions, or you can shop the area's plans and decide if you want to move into one of those plans. It is a special enrollment period. Medicare does give you a defined period of time to do that. So again, I can get specific about that. It's generally 2 months when you move to another area. So you move from here to Portland, you have a special enrollment period. You move from here to the coast, you have a special enrollment period. You can pick any plan that's available in that area. You move from here to the Bay Area, you've got a special enrollment period. So, but it's a great question. This is kind of silly that they say this. If you already have Medigap and you join an Advantage plan, you may want to drop. Again, it drives me crazy when they use it. You can't have both of those at the same time. You would want to drop it. Medigap only works with original Medicare. When you sign up for an Advantage plan, you're not with original Medicare. So this scenario should never be. It does remind you, keep in mind, if you drop Medigap to join Advantage, you may not be able to get it back. Remember, we talked about the enrollment, that they do have some medical underwriting. So again, that's probably getting a little bit too specific, but know that you can go back and forth, but sometimes it does require that your health be decent. I think, there are plenty of places, Medicare.gov, I mentioned that that's a great website. They even allow you to look at all the plans in our area. They're helpful. Don't rely solely on that, because the information, many times I've had clients come in and say, it says that this plan is this much and the information isn't accurate, but there is a lot of the fundamentals, a lot of the benefits are accurate. So, but there are extra tools that help you make decisions and help you answer questions. So,
And when you relocate, you become eligible for the GAP plan again, or no?
you do. If you move out of the service area, you have a chance to go back to square one where you started with Medicare. No medical underwriting, no health questions asked at all. Yep, can start completely over. I think we're gonna, wow. Let's jump. Could you bring up the Medicare Advantage? Okay, we'll start here. That's perfect. I mentioned that this law is about to go into effect. The reason it's a big deal for you, anybody on Medicare, I'm going to drop down here a little bit. Will you go down? Yeah, thanks. Will you go down a little bit for me so I can pull that up? Okay, perfect right there. Look at this. Your maximum annual out-of-pocket for your Part D, whether you have original Medicare and a standalone drug plan, or you have an Advantage plan, your out-of-pocket cost next year will be capped at $2,000. The maximum out-of-pocket this year is $8,000. So this is a big deal.
That's for drugs.
Prescriptions, yeah, I'm sorry if I didn't say
Sorry,
Part
no,
D.
you did. It's just I was looking at it. And
Yeah, so this is just Medicaid. But I have a lot of clients that pay $5,000, $6,000, $7,000 a year for, they have a couple medications that are expensive. 2 is the max. There is no longer the donut hole or coverage gap. If you don't know what that is, good. If you do, I'm sorry that you go into it, but it's no longer there. Used to be that when you went in the coverage gap, you paid for the whole cost of your medications. Now you're still subsidized. You don't pay for the entire cost. Next year, 2025, it's gone. There also is going to be, there's going to be a way, and this is a little bit complicated, I don't even know how to explain it yet, but you are going to be able, if you have, you're eligible if you're on Medicare, but if you have prescription costs that are maybe a little bit more expensive, you can spread those costs out over the course of the year. You do it with your drug plan or your Medicare Advantage plan. So the scenario is I go in January, my drug plan has a deductible, and my copay for this expensive medication is kind of a lot. So in January, I owe $500. You don't have to pay the $500. You could spread the $500 out over the 12 months of the year. So it's basically it's a way for people on Medicare to not get hit with a big, oh my gosh, I owe this much money. As long as you pay it off that year, next year, 2025, you can pay it any way that you want to. So again, if you take 2 generics and your copays are $6, you probably don't need this savings program or basically this installment program. But that's a big deal. It is a reason that plans are having to, when plans know that after this $2,000, and it's not just the plans, pharmaceutical companies or other people, original Medicare will be sharing in the brunt of this, but this is going to make a huge difference for people on Medicare, but also for the people that provide these plans.
So do you think it's just for 2025 or beyond and beyond?
So this I don't know about this, But I do know that the $35 cap on insulin is believed to be permanent. I do not see that changing. It would be additional
Yeah.
legislation that would go into place that would reverse this. And I don't know about the $2,000 being something permanent. I really don't. It's a good question, but this is a big deal. And then finally, if I could, and it's not a very good segue, but will you do my Medicare Advantage screen? And this one of my favorite clients sent this to me and said, "Hey, is this on your radar?" And the answer is, it is. I read a lot of things. I know that there's a lot of discussion. We live in a big country. Let's just say that the entire country does not operate or have the same issue, but it is becoming a problem. So Medicare Advantage plans that a lot of seniors love, hospitals and doctors are beginning to have an issue with. My sense is that most of it is related to Medicare Advantage plans ask for more prior authorization. They ask for more approval before you have things done versus original Medicare that rarely, they have some benefits that require prior authorization, but not as many. So I think the scrutiny, the extra paperwork that providers and hospitals have to, and the extra hoops they have to jump through, and the fact that they wait 4 or 5 or 6 months to have a hospital bill reconciled, it's beginning to wear on them. So
Do they get a similar
reimbursement, my understanding is yes. Medicare's assignment is what the Medicare Advantage plans use as well. So I don't think it's specifically dollars, because the Advantage plans, there was a couple of years ago, Asante sent something out saying, if you're not on Medicare Advantage, we encourage you to look into it. It was 2 seasons ago, end of 2022 for 2023. And I went, wow, that's interesting. And someone that I knew pretty closely that did have a little peek behind the curtain, which I don't have, said the Advantage plans actually pay an extra 4 or 5% sometimes to some of the hospitals. It's an incentive, it's kind of a bonus, it's built into that. So I do not think it's specifically, here's what we're getting reimbursed, and I think it's more about, and Missy, I'm sorry, would you just scroll down a little bit? I just wanted to see if there was any, that's the gist of it, but basically they said, it's close to half, I'm sorry, would you go back up? I'm sorry about that. It's close to half the people on Medicare, so they do keep statistics. Nearly 31 million people. I think it's about 65 million people on Medicare right now. Close to half of them are on these Advantage plans now. And again, some of the plans are for doctors to get paid. They're like, what do we have to do? They are making it difficult. Again, my understanding in our valley, these are private insurance companies. So here in our valley, it would be people like MODA. It would be people like Regents has a Medicare Advantage plan. Aetna has a Medicare Advantage plan. United Healthcare has a Medicare Advantage plan. Atrio. Some of them are specific just to Oregon, and they are apparently.
So it's interesting you said that it's the providers that find it bothersome, but I would think the patient is like, if they're having to wait to find if they're allowed a certain treatment while they're
also interesting, if your care is not fluent, it can become an issue for sure. So it probably works if there are extra hoops to jump through. You guys have been great. Sorry, I went a little longer into the evening than I thought. 9 o'clock is my bedtime. I don't know if I can get to Roosh before 9 o'clock, but anyway, I hope this was helpful. I hope you found a lot of information in there useful. I would highly recommend, again, this Medicare and You booklet. New to Medicare, you're going to get one in the mail. People already on Medicare, you get one of these annually. Peruse it, just kind of look through, look at your annual notice of change this year. For those of you already on Medicare plans, make sure you take special notice of it. So,
can you get those at libraries?
That's interesting that you ask. I honestly don't know if Does the metaphysical library? Probably doesn't have it, but I suspect that they can have my copy. I suspect that the libraries will. Oregon's pretty good. We don't have a SHIP. We have, what's the acronym? SHIBA. We have SHIBA, which is Senior Health Insurance Benefits Advisors, something like that. If you look them up, if you Google SHIBA in Oregon, we have 3 or 4 in Medford. They have copies of this, and they're good about, they are not insurance agents. They are unbiased. We will give you information. If you have specific questions about, will this be covered? How does this plan work? They're pretty helpful. They're mostly retired seniors on Medicare, and some are very, very helpful and very informative. Again, they don't enroll you in a plan. You do have to come to an insurance agent to do that. So, and now you guys know one that works in that office right there. So anyway, that's my time. I'm happy to answer any additional questions if anybody has any. I appreciated that you asked through the, if I had to listen to myself talk for an hour and a half straight without any questions, I would probably lose my mind. So it was nice that you guys stayed involved and stayed engaged. And because this is an educational event, so I'm not allowed to solicit.
Thank you.
Maybe Rob.
Yeah. Thank you guys. That's so nice. First time, maybe not last time. Maybe I'll do this again.